Hello and welcome to a fresh new episode of Science Monitor, our weekly update on all that is happening in the field of science and technology in and around the country. I'm Aishwarya Kapoor with you. Let us take a look at the headlines first. Recent study untangles the effects of increasing and aging population on cardiovascular diseases. Fresh breath of life to accident victims. First bike ambulance launched in Bangalore. Birds of many feathers flock here. India records the second highest bird diversity, says the new Great Backyard Bird Count. In our In Focus segment today, we explore the exciting 40-year journey of the Indian space science. In technology, you can use aluminium batteries that can charge in a minute, a new turn in energy storage. And now news in details. Deaths from cardiovascular diseases are on the rise, driven by a growing and an aging population. The revelation has come from the analysis of massive data on cardiovascular diseases. The analysis also shows that ischemic heart disease is the leading cause of death worldwide among all the cardiovascular diseases. More in this report.
Rapidly changing lifestyles and food habits, hectic and exerciseless schedules, stress, an ever-growing workload, everything ultimately takes a toll in the form of cardiovascular diseases. Managing the ever-increasing burden of heart diseases is a major healthcare issue today. Now, a recent study tried to decipher the effects of population growth, aging of populations, and epidemiologic changes in the disease on cardiovascular diseases. The study that has been published in the New England Journal of Medicine demonstrates how increasing and aging populations increase the number of deaths from cardiovascular diseases. A lot of number crunching and big data has gone into the study, which systematically analyzes the mortality data from the Global Burden of Disease Study 2013, which includes data on 188 countries grouped into 21 world regions. According to the study, global deaths from cardiovascular diseases increased by 41% between 1990 and 2013, despite a 39% decrease in age-specific death rates. Analysis shows that this increase was driven by a 55% increase in mortality due to the aging of populations and a 25% increase due to the population growth. Researchers involved in the study have also tried to establish the link between changes in gross domestic product per capita with changes in age-specific death rates. And interestingly, the analysis showed a strong correlation between changes in gross domestic product per capita with change in age-specific death rates, only in the upper middle class countries.
We must realize that a large number of these diseases are because of our lifestyles. That is, we have a large number of hypertensives in India, people who have hypertension. Then a large number of us have abnormal lipids. Although traditionally in the West, it is associated, these abnormal lipids are associated with high amounts of low density lipoprotein. In India, we have a very different risk factor profile in that we don't have very high amounts of low density lipoprotein. On the contrary, we have high triglycerides, we have modest elevations of low density lipoprotein, and we have very low high density lipoproteins, which is the good cholesterol. Also, we have a very high amounts of something called lipoprotein a. So these are factors which we'll group as dyslipidemia. Apart from this, a very important preventable lifestyle risk factor is the use and abuse of tobacco. If we think that we are enjoying and smoking a cigarette, actually it is the contrary. The cigarette is smoking us.
The study provides useful directions for planning the future of the healthcare system and benchmarking progress towards the reduction of cardiovascular diseases.
ambulances stuck in traffic or battling through narrow congested roads is not an uncommon sight in India. In cities with even advanced healthcare facilities, many lives are lost due to delay in getting the primary first aid care. However, there is going to be some relief as the bike ambulances are here. These bike ambulances will negotiate their way to reach the accident victims stuck in the worst traffic jams and at the most crowded nook and crannies of the city. Take a look.
Poor road planning, weak law enforcement, surge in trucks and cars, and a flood of untrained drivers. According to estimates, India is the world's capital of road deaths. While ambulance services and facilities like Medicine on Wheels have made a great difference to the way accident victims are attended to, providing instant medical care to patients stuck in congested, traffic-prone urban areas still remains a challenge. Now here's a new model of ambulance that will address this issue and reduce deaths due to road accidents. The Bike Ambulance First Response Unit, or the FRU.
When in India, visa can go and reach within 20 minutes. Why can't we go and say within our life within the few minutes what can be done? And various other things. So we plan the bike where to avoid the traffic congestion in the metropolitan cities and the city area. This bike ambulance should be implemented.
Launched recently in Bengaluru, the FRU is a motorbike ambulance operated by a trained paramedic equipped with first aid kits and oxygen cylinders. Hence, while the traditional four-wheeler ambulance battles its way through the traffic to reach patients or the accident spot, these bikes can easily reach the victim and provide instant medical care. Presently, about 32 bike ambulances have been deployed, of which 21 will operate in the 40 most accident-prone areas of Bengaluru city, while the rest will provide services in different cities of Karnataka. The bike ambulance will be implemented by GVK EMRI, which is already running the 108 Arogya Kavacha ambulance service in the city. The service can be reached by dialing 108. The operators, depending on the traffic conditions, dispatch the bike ambulance followed by the four-wheeler.
Come morning and the world around us becomes alive with a variety of musical notes. From the chirping of sparrows to the cooing of pigeons and the sweet cry of the cuckoos. What is the dawn chorus without the birds? From common crows to the magnificent peacocks, India is the land of rich bird diversity. Let us see what the great backyard bird count has declared.
With expanding cities and challenges like poaching, the population of birds has been drastically affected in the last few centuries. But here's good news for bird lovers. Now, India has become the country recording the second highest bird count of 735 species, after Ecuador with 784 species. The estimates have come from the Great Backyard Bird Count that was conducted in the middle of February. During the bird count, participants in Uttarakhand came in first with 383 species, Tamil Nadu with 324, Karnataka with 322 and Kerala with 299. As per the GBBC, while the most frequent species in India is the common crow, other frequently encountered species in India include the myna, rock pigeon, black drongo and Asian quail. The Global Great Backyard Bird Count is an event organized by Cornell University and the Audubon Society of the USA. The event encourages bird enthusiasts to look for birds globally and upload the information on an online portal to keep count of species. Following the encouraging increase, Specialists have proposed many measures to make our cities more bird-friendly. This includes planning cities with bird baths and feeding areas, along with suitable vegetation to attract and support bird species.
What is it like to not being able to see the wonders that nature has bestowed upon us? Blindness is a tragic condition whose suffering can only be experienced and not shared. And this is exactly what the Dark Village Museum in Ahmedabad aims to do. A visit to the museum can be a life-changing experience, making us really comprehend the hardships of the visually impaired.
Open to the public on April 13, the Dark Village is a village museum in Ahmedabad that offers an insight into the lives of the visually impaired people. The village, created under the project Vision in the Dark, sponsored by Union Bank of India, in collaboration with the Blind People's Association and the Italian architect Paolo Manzo, tries to mimic the dark world of blind people and give a peg of reality on how visually impaired people live their daily lives and what are the difficulties faced by them. The village themed pavilion has thatched roof huts, trees, bullock carts, a well and a temple with sculptures of gods and goddesses. Completely dark, the village is designed to give a lifetime experience to normal people by living life in complete darkness during the 15 minutes of exploration.
ये पहली बार ऐसा अनुभव हुआ है कि जहाँ पे 15-20 मिनट तक कोई भी लाइट नहीं है, कोई भी प्रकाश नहीं है और हमें पूरा सैर करनी है, पूरा एक्सपीरियंस करना है, सेंस करना है बिना लाइट के। तो एक एहसास होता है कि जो लोग सच में नहीं देख सकते, जिनकी पूरी जिंदगी ऐसे अंधेरे में है, वो लोग कैसा महसूस करते होंगे, उनके लिए क्या-क्या तकलीफें आ रही होंगी उनकी जिंदगी में, छोटे से छोटे काम को लेकर बड़े से बड़ी मुसीबतों का वो कैसे सामना करते हैं।
Visually impaired people act as guides in the Dark Village, directing the visitors.
And now it is time to take a short break. We'll be right back. Keep watching Science Monitor. Welcome back. After the break, you're watching Science Monitor. Let us now have a look at some important science and technology activities happening in India and abroad in our next segment, Science Express.
With the aim of establishing a frontier marine science and technology research center, a memorandum of understanding has been signed between India and France recently. The proposed institute will carry out fundamental and multidisciplinary research on the most important topics in marine biology and marine biotechnology. The institute is a collaborative venture of India's Department of Biotechnology and the Université Pierre et Marie Curie and the National Centre for Scientific Research of France. India has been designated as the chair to the 9th meeting of the International Renewable Energy Agency Council, which is scheduled to be held on the 10th and 11th of June 2015 in Abu Dhabi. In short, known as IRENA, the International Renewable Energy Agency is a principal platform for international cooperation and a repository of policy, technology, resource and financial knowledge on renewable energy. Dental hygiene is an important aspect of healthcare. In order to promote this message, a bike rally was recently organized in Jaipur. The bike rally, called Ride for Smile, was organized by the Indian Orthodontic Society to commemorate the completion of its 50 years. Under this initiative, the participating dentists offer free orthodontic treatment to 10 orphans adopted from various NGOs. The Robotics Research Institute in Bengaluru, Novatech Robo, recently organized a Robo Fest in association with Lawrence Technological University, Michigan, USA. The fest displayed an interesting array of exhibits, including talking and dancing robots. More than 100 students, professionals and science enthusiasts attended the event. The unique display of robots in the exhibition included ones that could talk to human beings, drive cars and play video games with them. In an interesting new study, NASA is planning to launch a nuclear-powered submarine on Saturn's moon, Titan. The submarine will explore the largest methane sea called Kraken Mare on Titan. The submarine concept was showcased by NASA's Glenn's Compass team and researchers from Applied Research Laboratory at the NASA Innovative Advanced Concept Symposium in Florida. NASA hopes to use a submarine to explore the chemistry of Titan's seafloor and sea composition. It also aims to study its tides, weather, shoreline and islands to search for any type of life.
From Aryabhat in 1975 to Mangalyaan in 2014, India's 40 years journey in the field of space sciences has been exciting, nonetheless challenging. From remote sensing, weather forecasting and telecommunication to analyzing the surfaces of Moon and Mars, Indian space science has indeed come a long way. In our In Focus segment today, we'll be following this exciting journey of Indian space during the past 40 years.
April 1975, Aryabhatta took off from Kapustin Yar in Russia aboard Cosmos 3M launch vehicle. Aryabhatta was India's first indigenous satellite built by the Indian Space Research Organisation, ISRO. Aryabhatta marked the earliest success of India's long and triumphant space program that was yet to be realized. With humble beginnings, India's ambitious space program started in a small fishing hamlet near Trivandrum in Kerala called Thumpa, where a small church became India's first space workshop and the adjacent bishop's house its office. However, thanks to the persistence and vision of its researchers, 40 years later and after many victorious feats in space science, India is today the first nation to reach Mars in its maiden attempt. Indian Space Research Organisation, ISRO, India's space agency was set up in Bangalore in 1969 and Aryabhatta's launch on 19th April 1975 marked the first success of Indian space program. Following this, India has launched 77 Indian satellites successfully for various purposes. The country has mastered modern space technology and its various applications for the benefit of society. Unlike the programs of other major space-faring nations, largely driven by military goals, India's space program mainly focuses on developmental objectives like telecommunications, weather watch, resource mapping related to agriculture, forests, water resources and minerals to mention a few. Hence, while the satellites like Bhaskara series is specifically designed for collecting data on telemetry, oceanography and hydrology for research and agricultural purposes, the Rohini series and Apple provided extended nationwide telecommunication coverage in the form of television and radio. The Indian remote sensing satellites, popular as IRS, during the past decades has extended tremendous support to the national economy in the areas of agriculture, water resources, forestry and ecology, geology, watersheds, marine fisheries and coastal management. On 20th September 2004, ISRO achieved yet another success through the launch of EduSat satellite, also called as GSAT-3. The satellite was exclusively devoted to meet the demands of educational sector and interactive satellite-based distance education system for the country. EduSat has revolutionized classroom teaching through IT-based technology. The role of Indian satellites is clear from the accurate and timely prediction of the cyclone in 2013. ISRO satellites provided vital information on when and where the cyclone would be the most intense, based on which timely evacuation of over 1 million people was possible. India's recent venture into space includes the Indian Regional Navigation Satellite System, shortly known as the IRNSS. IRNSS is India's indigenous satellite navigation system, which will be under the total control of Indian government. IRNSS aims to provide navigational and security services to India and provide accurate position information service to users in the country. The system will help in terrestrial and marine navigation, disaster management, vehicle tracking and fleet management. In 2008 came one of the most important contributions of India's space program in the form of Chandrayaan. Chandrayaan-1 made a breakthrough discovery when it detected the presence of water on the moon, along with a large cave below the lunar surface. Celebrated as one of the 25 best inventions of 2014 that are making the world better, smarter, and in some cases a little more fun. India's Mars Orbiter mission, popular as Mangalyaan, is the most recent feather added to the cap of India's space program. Based on indigenous technology, Mangalyaan is the lowest budget probe compared to missions of other space agencies till now. The spacecraft has successfully captured many images, including the rare full disk color imagery of Mars, which is immensely aiding researchers in their studies on understanding the planet. Hence, it's clear that during the long and arduous journey of 40 years, ISRO's technologies have played a huge role in transforming the lives of ordinary Indians. The contributions have been in many diverse areas, ranging from adult literacy and distance learning programs to prediction of weather patterns, natural disasters, and telemedicine. Our experience has clearly shown that self-reliance in space technologies plays an important role in national development. Hence, as ISRO ventures further, let us all join together to wish the scientific team success in all their efforts.
And what are the contributions of science to this week's history? We shall learn in our next segment, History of Science.
Salyut 1, the first space station in history, was launched into orbit on 19th April 1971. The space station was launched by the Soviet Union using a Proton K rocket. Salyut 1 was an important experiment that gave ideas about living and working in space long-term and paved the way for future space stations. Salyut 1 orbited the Earth almost 3,000 times during its 175 days in space before it was intentionally crashed into the Pacific Ocean. The Central Fuel Research Institute, CFRI, a constituent national laboratory of the CSIR, was inaugurated on 22nd April 1950. The laboratory was set up primarily to conduct high-level research in fuels, especially in quality assessment of coal resources, support steel industries, etc. The institute is today known as the Central Research of Mining and Fuel Research. The Central Leather Research Institute, or the CLRI, another constituent of the National Laboratory of CSIR, was founded on 24th April 1948. The CLRI is the world's largest leather research institute. It is a central hub in Indian leather sector with direct roles in education, research, training, testing, designing, forecasting, planning, social empowerment, and leading in science and technology relating to leather. The British journal Nature published the first paper on the structure of DNA on 25th April 1953. The paper, called Molecular Structure of Nucleic Acids, a structure for deoxyribose nucleic acid, was authored by James Watson and Francis Crick. It was the first publication which described the discovery of the double helix structure of DNA using X-ray diffraction and the mathematics of a helix transform. Because of its importance in life sciences, this article is often termed a pearl of science.
On to our next segment, technology you can use. Imagine there is an emergency and your phone's battery has died. It can be a frustrating hour or two wait to recharge the phone's battery. Well, you will never get into this situation with Stanford's miraculous, fast-charging, long-lasting and inexpensive aluminium batteries that can charge in less than a minute. Take a look.
Aluminium batteries sounds ordinary, don't they? But the properties of these new batteries developed by the researchers of Stanford University are far from ordinary. Claimed as the first high-performance aluminium batteries, they are fast-charging, long-lasting and inexpensive. The battery has a very simple design and is made up of cheap materials like aluminium and graphite.
It's made of aluminum and graphite. Both materials are quite cheap. Right now it's lighting up a LED light, and you can bend it, and still you can see the LED light is still on while you are bending it. Similarly as this, we have two batteries with a cell phone, so it can provide like 5 volts, and it can be charged within a minute. It's possible to have like bendable cell phone. It can be further improved, and this is a great start. We think that it has a bright future.
The setup consists of 2 electrodes, a negatively charged anode made of aluminium and a positively charged cathode. And not only this, these batteries charge in less than a minute and are bendable, making them ideal for the new generation of bendable gadgets. So in near future, we may soon say goodbye to alkaline and lithium-ion batteries, which are not only expensive but also unsafe and harmful for the environment.